is Dr. David Limbrick. He's the Chief of Pediatric Neurosurgery here at St. Louis Children's Hospital, and he's going to give you a quick research update.
Great, thanks. So I do have some slides prepared, and we'll maybe go through them a little bit, but at the end I was hoping to maybe just get some ideas from everybody here, kind of what they see as priorities for research going forward. So I'll go through what I have planned here, but I'd sort of almost rather spend most of the time kind of talking in a casual way about what you guys see as priorities. But I'll go through some of this here real quickly. So, as everyone knows, Chiari and Syringomyelia are uncommon disorders, and as Dorothy was saying, one of the only ways to make progress in understanding this disease, why it develops, who's predisposed to it, how we treat it, how we diagnose it, how we understand how people will do best. The only way to do that, since it's an uncommon combination of disorders, is to use multiple centers and collaborate. And really the crux of this is having patients and their families participate. So first of all, thank you. I know most of you, or some of you in the crowd here, have participated in our efforts to advance the care of patients with these disorders, so thank you all. So many of you will be familiar with some of these things. We were fortunate a number of years ago to receive a donation, a significant donation that allows us to create a multi-institutional database. This was the grandfather of a patient who had a complicated series of problems related to Chiari and Syringomyelia. And so this consortium that we formed, the Park-Reeves Syringomyelia Research Consortium, was developed, and this was around 2010, 2011. And when we first started it, our vision was that we were going to try to collect information on 1,000 patients, and I think the biggest group of patients was on the order of 100, and they were all from one institution. And our idea was to say, let's see what we can learn collectively across the major centers of the United States. So we formed this consortium. It's multidisciplinary too, orthopedic surgery, neurosurgery, radiology, numerous other subspecialties. And at this stage, it was mainly medical caregivers, and we've sort of transitioned away from that to be more of a comprehensive platform where we involve patients and families in this whole sort of PCOR, or patient-centered outcomes research initiative. But it really is now 42 centers across the United States. You can see it's a huge number of centers, and to coordinate this sort of multidisciplinary, multi-institutional platform is really a tremendous amount of work. And Tanda, who just did all the introductions, and we have one other person here at St. Louis Children's named Tammy that many of you have interacted with, they really do all of this. And you can imagine HIPAA sharing of data and all the agreements and contracts and data use agreements that go into this particular research platform. And again, Tanda and Tammy really take care of all that. But it's a unique thing to have a platform like this, 42 hospitals, and it's allowed us to answer questions like, what are the different MRI measures we should be looking at? If I measure this obscure measurement on an MRI scan, am I measuring the same thing as my colleague in Denver? And that's critical, right? And so we've been able to answer some of these questions. We've been able to look at, with a large number of patients, what's the relationship of Kyary, Syringomyelia, and spinal deformity, scoliosis. This is a common complication, and we've been able to do this. And you can see that each one of these projects are sort of led by different people. We all work together, and everybody sort of has their one area, and we like to believe that that really enhances the productivity and our ability to provide impactful findings with respect to these conditions. Here's another question. When do we do fusions of the base of the skull to the top of the spine? As many of you know, this is a common complication of patients who have Chiari and at times Syringomyelia. And wouldn't it be great if we knew, should we be doing this operation up front? Meaning at the time this is diagnosed, should we be delaying it? How should we approach it? Are there any parameters that we can identify that might help us to understand who might need these kinds of operations? These are not trivial operations. There are technical challenges to them, so we want to make sure that we're deploying these things in a way that's as effective as possible and really helping patients. And so we're able to answer these questions, which are really, really rare things overall, by collaborating across North America. About 2012, 2013, we started to kind of think that maybe we were focusing a little bit too much on MRIs and surgeries and who got an infection or who had leakage of spinal fluid. And we started to think, well, how are patients really doing? If we ask the patients, how are they doing? Are their headaches better? And it turns out that of the hundreds of articles that were out there published in the medical literature, very few actually asked the patients. And so almost all the outcomes were judged on the physician gestalt. And if you're not really familiar with what that really means, is it's the doctor saying, better or not better. And that really seemed like that wasn't the optimal way to be judging how we're doing things. So we have looked over time at what we can be doing and partnered with a group at Vanderbilt led by Sheva Shannon and Jay Wellens, and they developed a disease-specific outcome tool to help us understand quality of life. So while many groups will sort of use generic outcomes scales to help with understanding how somebody's health is doing after treatment of a disease, it's useful to have disease-specific questions, and so that's what this is. So now we've brought this particular scale, which is called the CHIP, or the Kyary Health Index in Pediatrics, into our clinical research studies, and we've rolled this out across our collaborating institutions in order to help us understand not just if the MRI is better or if somebody needed a second surgery, but how are people doing? Are they in school at the desired grade level? Are they able to hold down a job? These sorts of things. Another thing that we've been working on, and this may not project too well because of the lights, but that's okay, is using advanced MRI scans in order to help us understand who might do well with surgery, who should not undergo surgery, and so forth. And this is hydrodynamics, and this is what we just heard about from Dorothy, is this hydrodynamics. And what that means is how is water flowing around this junction of the brain and spine. So if this shows, what you can see here is this is the cerebellar tonsil of the Chiari, and then you can see this fluid within the spinal cord, the Syringomyelia. And what you'll see is there's impressive downward, with every heartbeat, you can see that these cerebellar tonsils are pistoning down, and we believe that this has to do with the physiology of the symptoms and the disease of Chiari malformation and Syringomyelia. And then, after surgery, you can do the same scan and the pulsatility is gone. So can we use advanced MRI tools like this to understand who might benefit from surgery, who might not benefit from surgery, understanding, of course, as I said, that each one of these surgeries has some risk associated with it. So these are some of the kinds of questions that we've been addressing with these multi-institutional platforms. One of the things that we've been studying with some financial support from ASAP, which is a patient advocacy group as well, is what's the role or impact of socioeconomic and demographic factors and how access to health care is provided. And it is something that we've been looking at, how, for example, sex, race, ethnicity, and insurance status and zip code is a proxy for income and resources, how do these factors impact how much access individuals from all communities have the ability to be cared for with these diseases. And we have some interesting findings that we're just tabulating at this point. But there are disparities for sure in some of these different parameters in terms of access to expert care. One of the questions that Dorothy mentioned that we've been looking at is whether one of the two major variations of surgery might be better than the other in terms of helping people with Chiari and Syringomyelia. And if you've been to these meetings before, you've heard me talk about this. This is probably the most controversial question in all of pediatric neurosurgery is which of these two operations is best for a patient with Chiari and or Syringomyelia. And many of you in the room are familiar with this. We make an incision at the base of the skull in the back, and then we remove a window of bone here from the base of the skull. That's that suboccipital craniectomy. Oftentimes remove the back of the C1 there. That's that C1 laminectomy. And cut some of these fibrous bands that restrict this area and continue to compress the cerebellar tonsils. And in some cases, so that's that posterior fossa decompression, and in some cases we go one step further and open the layers around the brain and spinal fluid called the dura and sew in an expansile graft to give more room for fluid flow there. And whether operation number one, less invasive, operation number two, a little bit more invasive, but probably creates more space for fluid flow, which of these is best? And again, this is probably one of the most controversial topics in all of, not just Chiari, but in all of pediatric neurosurgery. This has been studied by many, many people over the years, but nobody's ever done a clinical trial. And so we know that probably that second stage, that duraplasty, is probably associated with a higher rate of complications like cerebrospinal fluid leak, the accumulation of fluid underneath the skin, maybe a reaction of the brain and spinal cord or the layers around them that looks like meningitis, for example. But that may also be more effective. And this is, I know many of you in the room have been sort of involved in some of these decisions for your own children. So we don't know the answer, which is best, but it is all over the literature that we should be doing a clinical trial for this. So what we did is, since we have this multidisciplinary and multi-institutional platform, we thought that maybe we could, as a group, a North American collaborative, be able to answer this long held question. And we partnered with some of the biggest groups in neurosurgery, like, for example, the American Association of Neurological Surgeons, the Congress of Neurological Surgeons, and the pediatric section of those groups. And we partnered with Dorothy and CSF, the Kyary and Syringomyelia Foundation, and other groups in order to say, can we work together to help answer this question? And I won't divulge any identities, but some of the parents in this room have been an important part of this trial too, and we asked them to participate not just at the outset, but as much as they're able to participate and help us in our quest to answer this question. And what we're trying to do is effect a paradigm shift away from what we see as a reliance of surgeons on their own personal experience or what they were trained to do, to actually have high quality data to be able to answer this question for which of these operations seems to be best in terms of preventing surgical complications or harm, maximizing the relief, symptomatic relief, in other words, getting rid of symptoms, helping to eliminate the Syrinx, and to provide the highest quality of life. And those are the seminal questions that we're trying to answer with this study. And this has been a huge undertaking. It's funded through the Patient-Centered Outcomes Research Institute, and this is the PCORI that Dorothy mentioned before. And again, I just want to acknowledge everybody in the room here that participated in the study, all of the patients and families who helped support this directly, and also CSF, who played a really seminal, important role in helping us to conduct this study. I won't go through the various inclusion and exclusion criteria, but just know that we have some specifics as to who could be a candidate, so we can make sure that that when we have our results at the end, that we know exactly what they mean, and that we can really make important observations from this trial. We have specific radiological measures as well, and many of these that you already know, for example, looking at the tonsil position, the cerebellar tonsil position, but also looking at specific angles of the junction of the cranium or the skull base to the spine, and helping us to understand again who might be better suited for one operation or the other, but also who might be more apt to need a fusion down the road. So again, these are all really important questions. And this is just too busy to go through any detail, just to let you know, and again, many of you have been through this with us, that there are very specific time points to be seen, and very specific questions to be answered at every step, and we really appreciate your help on this. But the key is just making sure we're as rigorous as possible, so the information we get back is of the highest quality, because we really want to make a very good, we really want to answer this as best we can. One of the things that's really unique about this, and Dorothy touched on this as well, is that this PCORI group, more than anything, they want to bridge the gap between patients, families, and advocacy groups, and the investigators who are doing the studies, and the doctors and clinicians who are treating the patients. And before this, I'd never really been involved in anything like this, and I've just been struck with how great it is to talk to patients and get their input on these studies that we're doing. When we formed this group, I'm just going to tell you a funny story. When we formed this group that we're all sitting in right now, we had our first meeting probably 3 years ago. Dorothy, is that right? 3 years or so. And it was a room like this, a lot of people there, and at the end there were some questions, and I remember so clearly somebody raised their hand. They said, well, Dr. Limbrick, do you ever see people with itch? And I said, no, we don't see that. And it was a mother, and she said, well, it's really odd. My child has this itching sensation. So I asked the crowd, I said, does anybody else have an itch? And I swear 80% raised their hand. I need to get more information from the patients, you know what I mean? So it was really instructive, and that's actually why I thought maybe as we wrap up here in just a minute, we could take 5 minutes to just say, are there any questions that you'd like us to answer? Because we do have this enormous data set now, and we have the ability to answer questions that wouldn't necessarily occur to us as caregivers. So, but each of these groups here we've been working with, and you can see that this here, of course, CSF we've talked about, and then the St. Louis chapter of CSF, of course. But even at our peer institutions in Nashville and other places, we've been running similar events to this to help not just inform our research, but mainly to provide information and education to the patient community. And this is a great example of this. We've done these workshops before, and I think that what we've tried to mainly do, again, because I come from a specific point of view as a physician, is we've tried to provide physician expertise to this group. And today's meeting is a little bit different, and I think probably going to be even more informative for everybody here. And this was Tanda's idea, actually, and she has experience with other advocacy organizations, and the idea from today's is to really help you, and so not just touch on another MRI finding that's important, not that, but instead to help you as families and parents and patients navigate the world going forward. So I'm really excited about today. So here's our enrollment on this trial, and I'm happy to report that we hit the target actually last month in July, and we had not anticipated hitting that target until December. And so the research funder, PCORI, was so encouraged, they asked us to continue to enroll in this clinical trial until the end of the year. So we're going to even exceed our targets. And again, I just want to say that's because of all of you and because of our collaborators across the country. And really can't thank everybody enough for that. And again, I think that a lot of the success, because there were early challenges in getting everybody, educating everybody in the patient community, educating everybody in the neurosurgery community and the advocacy community, and we couldn't have done it without CSF, who really at every stage helped us to get information out through posting it on social media and other routes. So again, I just want to say thank you for supporting that. Here's just an example, another example from CSF, how they've provided an informational brochure about this to our collaborating institutions across the country. And I did want to just plug CSF one more time. The one, Dorothy personally, with assistance of the board of our organization, but really it was pushed forward by Caitlin and Dorothy, the development of what are called common data elements, and that's about as vague a term as you can get, right? So CDEs, common data elements, are a way to ensure that all research that's done in this field or related fields, we're all collecting the same data. It gets back to that physician gestalt, whether the physician's just eyeballing how somebody's doing, or can we have the same kinds of outcome metrics that we all study and the same way we diagnose the disease. If we can standardize that across all studies, then we'll all benefit. And this was a remarkable achievement. It's now being published in the Journal of Neurosurgery right now. And the other person to really thank is Mark Luciano at Johns Hopkins, who also helped push this forward. Now Tim, who's in the back, wearing the white coat in the back, you guys have probably all met him, or many of you have met Tim. He collects DNA from our patients, and then we collaborate with groups across the country. Here you can see a limited number of the ones that we collaborate with: Utah, Stanford, Duke, Vanderbilt, Ohio State, Alabama. And what we're trying to do, as many of you already know, is determine why this disease develops in the first place. And if we can figure out if there are genetic predilections as to why it develops, we can improve our ability to diagnose other people. We can understand who's going to progress. We can understand what the best diagnostic and treatment tests and procedures are. And already, I think, and Tim, you can correct me, but I think we have 400 patients that we've done whole exome sequencing, which is looking at all the genes that are expressed or used in the body. And so we're making great progress on that. Again, thanks to everyone here, but we're still working on that. So how do we think about this? If we think about Chiari and Syringomyelia, the evaluation phase, the treatment phase, and how we study outcomes, we're trying to hit it really on all different, at every different step here, whether it's MRI scans with advanced dynamic tonsillar imaging like you saw, whether it's looking at advanced metrics that we can measure the junction between the spine and the head, whether we have tools in order to help us stratify or make equal groups between different studies. If we can look at the treatment itself there, we can look at our outcomes using the CHIP, the quality of life instrument. We use advanced MRIs, and we can look also whether people needed other surgery or had complications. And of course, the genetics, kind of putting it and tying it all together. So I'm actually going to stop there. I think I'm a couple minutes early, so I'd love to take any comments or questions about what we've discussed or what you guys see as priority studying going forward. Yes, ma'am.
We're wondering with the studies if there's any correlation with genetic mutations in the Kyary
Right.
Y'all are finding out.
I'm happy to take that. Tim, do you want to answer that?
So we're currently in the analysis phase of our project. We found several mutations that could be associated with it. We haven't come down anything in particular yet.
So, I mean, I'll just say one or two other things. So what we're doing is we're not just studying one particular gene, we're studying the whole genome of that's used. And so part of it, of this task is identifying mutations that we find and whether they're likely to be relevant or not. And I know that we have a number of candidates now that we're really focusing down on. And so, but it's not quite ready for prime time for really using it as a diagnostic test yet. But, you know, I would like to sort of set it as maybe like a 5-year goal. I bet within 5 years we're going to, and, you know, 5 years ago I would have said 20 years. You know what I mean? It's really sort of ramping up in terms of how we're finding things out. So I think if you continue to attend these meetings, every time I'll give something like this and I'll have more. But we definitely just in the last few months have come up with a few candidates that are promising. Yes.
I was just kind of curious as why frontal head pain has been excluded as a symptom for Kyary, and it's always questioned about the back of the head when a lot of people tend to have frontal head pain as well. Like, why is that excluded as not being Kyary specific?
Yeah, so I will tell you that this is exactly why we need to do this research, right? So everybody, myself included, always asks about headache at the base of the neck, or at the base of the head or at the top of the neck, and I think that's pretty classic. Headaches are complicated, though. So in all of our work, we collect where the headache is, and we can see exactly what the frequency is. And what we found is I think that back here is pretty reproducible, but what we found is if somebody says I have headaches everywhere, that's also very commonly related to Kyary. So we call that holocranial, which certainly includes the front as well. But we collect that information on front, temporal, and in everything else. And right now, actually, in my email inbox is a paper with all the presenting headaches of everybody, of the 1,600 patients in our registry. So I'll probably be able to answer that for you within a month or so.
Okay, and can I ask one more?
Yeah, of course.
Without a Syrinx or the tethered cord, the leg pain, that seems to be something that a lot of people have. If you don't have the other two things, can Kyary alone cause that, or would it?
I think as clinicians, we like to have something where we can point to it on the MRI and say, aha, here's the cause.
Right.
And so that's why you always hear me in this case, asking, is there a Syrinx? Because a Syrinx, we can point to it and say, aha, this is the direct connection. But for sure, there are people without Syringomyelia that can have symptoms, but we tend to be narrow-minded, and if we don't see it on the Syrinx, we tend to be, on the MRI scan, it's harder for us to connect the two, but for sure it happens. I'm sure you've read that.
I'm experiencing it with
Right.
my 7-year-old, so yeah.
Right.
And that's what I'm trying to figure out, why that's,
Right.
because, he doesn't have the Syrinx or the tethered cord, but he has the genetic condition that could be causing that too, so it's,
Right.
like you said, hard to point, because there's not something saying that is what's
Right.
causing them.
So I have a question from our online participant.
Great.
She says, where can I get access to information that has been collected for Kyary patients? I have a 19-year-old son, 8 years posterior fossa decompression, who is now experiencing lightheadedness and sleep issues, wondering if it's related or not.
So the question I'm just going to repeat for the online group. It's essentially, where can we obtain information about the symptoms of this 19-year-old who's, Caitlin, can you repeat the specific?
8 years post-op.
8 years post-operative.
Posterior fossa decompression.
Mm-hmm.
Experiencing lightheadedness and sleep issues.
lightheadedness and sleep issues. So I think that it's hard to track down that information. I think that there are medical research papers that are out there that will contain that, and you can access those through the National Library of Medicine, which is PubMed. But that can be challenging, and it can be tough to read those papers. And so I will admit that. And Dorothy, do you know, I think the CSF website has a lot of information.
We do, like if you go to the CSF website and you have a specific topic like sleep problems,
Mm-hmm.
and you put that in, you'll get videos. They're organized either by speaker and area or by topic, so you can find some information on there.
Okay, I'm going to repeat that just through the microphone. So what I was saying is you can go and find it in the medical literature, but that can be challenging. And Dorothy, who's the director of CSF, has just said that there are videos available on the website that cover a lot of these topics. And for example, she mentioned one with sleep particularly that's available on the CSF website. And that would be easy to access, it's free, I do want to just say that, similar to the last question, we're on the verge of having a lot of that information very soon that will be published in the medical literature, but will be very approachable. And the next time we have a meeting like this, I'm hoping that maybe I can take these several questions we've got and actually show you the data, because we have it. We have it. Dorothy, did you want to say?
I have a question. For the papers that are coming out from this database, this is like a great resource. Is there a place on your website, or is there a way to link so that people have access to information like that?
So this is a great question. So the answer is, the turnaround once the paper is submitted, which it will probably be submitted within the next 2 weeks, is about a 6-month turnaround, I would say. So it should be published in about 6 months or so, if we're fortunate enough to get it published. And right now, the only way to access those papers are through PubMed, and many times you need to have an institutional license to access that. So that seems like that is not the best method. So I am looking at Tonda, who has just redone our website. Was it yesterday? It was literally yesterday we met about this, and I think we should link all those papers there. Maybe we could include the PDFs on our website, as long as the journal is okay with that.
We can also, St. Louis Children's Hospital, and I'm sure other hospitals around the country, we have our Patient Family Center Resource Center that offers you access to those sites, so you wouldn't have to pay for your own access.
Maybe I'll just say what Tonda just said is that you can access through St. Louis Children's Hospital, or probably similar institutions, through their resource center will provide access to information like that.
So I have one other question with that. I just thought maybe we can have a grad student or somebody summarize, do a summary that is less technical for people to.
I think that would be great. I think. So what Dorothy is saying is maybe what we could do is distill some of this medical literature to, because it will be, I've seen it, it's going to be overwhelming, the amount of volume. Maybe we can have them, the salient points can be distilled down and accessible on, the CSF website, and, maybe right. So we will work on making all these things more approachable. I'm sorry, did you have a question?
I have a comment and a question. The comment would be that one of Keegan's first symptoms was sleeping problems, and he was treated for a year and a half with obstructive apnea, which was wrong, at Children's. So I feel like this information should be distributed to other departments, just so that they know to be looking for those kind of things, especially with a kid that had had a spinal surgery at 5 years old. That should have been something. So not just neurosurgeons and orthopedics, but also maybe pulmonary. And my question is, do you think that there's value in evaluating the patients with regards to connective tissue diseases prior to doing surgery? Because that adds complications like cervical instability and scarring, which would then lends you to think you need to do the duraplasty because of the excess scarring. So is that something that you think should be done ahead of time?
So two questions here. One was specifically about sleeping problems, although I think this could include any problem, is making sure that we don't just disseminate the information amongst neurosurgeons and orthopedic surgeons, but all subspecialists who are involved in this. And sleeping problems are a really major and common problem in the Chiari and Syringomyelia world, and we should do a better job disseminating that information to all specialists. So in this particular case, having what it sounds like was initially described as an obstructive sleep apnea may have had a component that was related to a central source as well, and maybe sort of making sure that all specialists are aware of this would definitely be helpful, and we certainly can try to do that. Maybe we can work with you on doing that as part of this PCORI grant. I think that would be really great. And then the second question had to do with connective tissue disorders. Now this is, I would say, one of the most important topics that's covered at many meetings that I attend with Dorothy. We, over the past maybe 10 years, have learned more and more about the intersection of Chiari, Syringomyelia, and connective tissue disorders. And we didn't get into it, but Tim, when I was asking him to share a little bit of the information of what we'd learned through genetics, what we're learning is probably a lot of the genes that we are identifying are related to the development of the skeletal system and connective tissue. So there is definitely a real overlap between connective tissue disorders, Chiari, and Syringomyelia. And the question, this is a long-winded answer, I'm sorry, but the question really has to do with, should we be assessing patients before they go to surgery for connective tissue disorders, because there are more complications and more long-term problems can be associated with when Chiari and Syringomyelia have a true basis in connective tissue disorders. And the answer to that is yes, absolutely. I think this is something we didn't know anything about, and Dorothy might remember the exact interval, but less than 10 years ago we didn't have a full appreciation.
2012 was the first time it was brought up in.
So 2012 is sort of dating when we started to become more aware of these intersections. And the one thing that you may have seen on Dorothy's slides earlier is the Ehlers-Danlos group, and EDS, as many of you know, is one of the connective tissue variations that we really focus on. And I would say that, again, Tim comes in and does something called the Buyten scoring in our group here. And the Buyten scoring is a way of assessing, using just a few physical maneuvers, whether somebody's likely to have a connective tissue problem or not. And we do it mainly for the purposes of understanding the genetic basis, since he's working on gene studies. But I definitely call him if I am suspicious and have him come and do it anyway. So we are trying to be better about that, and I think that is a fantastic point, that it should be part of the standard assessment of Chiari patients before surgery. If you are in this room and your child had surgery here, we have had this in mind, but I think that there are many places where maybe that's not fully fleshed out yet. All right, so I've run over my time, but hey, listen, I will say that this has been really helpful for me for many different reasons, and I really appreciate this, and we will take this back and we will make our findings widely available. We will make them easy to access. We'll make them easy to distill down into relevant findings. We will post them with Dorothy's group and on the website here, and we will look comprehensively at headaches and at connective tissue disorders and at sleep. So thanks for this. This is great. And next 6 months, when we do this again, I hope you guys will hold my feet to the fire. Thanks.